Good, we'll get started then. I was spinning there for a bit for some reason. It's been one of those weeks. I want to welcome everyone to the February live online symposium put on by the Oates Institute and co-sponsored this February by Mercer University, McAfee School of Theology. We appreciate their willingness to co-sponsor this, and Dr. Massey, Denise Massey, will be doing one of the presentations later, and perhaps she will talk a little bit more about Mercer and some of the programs they offer there. I am Rick Underwood, the director here at Oates Institute, and we are very excited to have outstanding presenters, 5 of them, over the next 2 weeks. And I'm moving on up in age and have been a practitioner for many years as a professional pastoral counselor, and now as a PRN chaplain, and and as a small church pastor. And I know from personal experience and professional experience that we're pretty good at knowing the theory about compassion fatigue, knowing how to help other people, but oftentimes don't follow through in our own care plans. So this is a very practical symposium, and it invites you to participate fully in the ways that we have outlined here. And just to do a quick overview, Dr. Figley's going to kick us off here in a few minutes. We sent out some pre-work, or at least some pre-review materials, and she will give us some instructions about that. And then she will come back at the end of our time and help wrap up this experience. Dr. Denise Massey will join us along the way, as will Dr. Jennifer Baldwin, Dr. Ty Mendenhall, and Karen Lovett. So the format will be roughly 90-minute presentations with some time at the end for your questions of Dr. Figley or our presenter. And there is a chat box, and as we get started, it would be helpful for us to get connected. It looks like we're about 20 and growing here in number. If you would just maybe make a note in the chat box of where you're located and what kind of professional interest or work that you're doing, and as it applies to compassion fatigue. We'll also have a discussion group. I will send out an email, and we'll do a simple reply all email to have some time to, at your own convenience, to reflect on what's being said, and to interact with each other as a way to integrate the material that we will be hearing and reading about. So I hope you heard that introduction. And again, I'm so pleased to introduce to you Dr. Kathleen Regan Figley. And I'm going to let her tell you what is important from her standpoint in terms of introduction as we get started. And we added, she was kind enough to add on the possibility of any of you that want to doing a little extra work and getting a certification through her organization, through her train the trainer credential as a compassion fatigue educator. So maybe Dr. Figley, if you would start off with that, and I will turn it over to you and be monitoring the chat room. And when you're ready to entertain questions, you can let folks know, and they can either turn their mic on. We're only 20-something now, so mics one at a time turned on won't be too bad. Or they can put it in the chat, right? Welcome.
All right, and really quickly, Rick, we are having just some troubleshooting for audio, so we'll give us connected in just a second. Dr. Figley, I'm showing that you're not connected to audio, although you are the presenter. So you should have some icons. One looks like two people, one looks like the chat window, and one looks like a little gear or settings. And under that, it should give you some audio options in your GoToMeeting panel.
Well, y'all are getting her hooked up, Tommy. Just read through the chat introductions here. It looks like Cheryl is a CPE educator. Chaplain and CPE educator from Southern California. We're happy to have you. We have Karen Levitt, who's one of our presenters, joining us. She's a former pastoral counselor with 25 years experience and has transitioned in doing life coaching and focusing on stress and performance. And you'll enjoy her presentation later. We have Julie Scott from Cincinnati. Welcome. She works in is the director of senior living there, and they specialize in dementia. Cheryl Bird is a CP educator, and let's see, welcome. Adrian says, hello, I'm in Tennessee. I'm a student at McAfee. Started my clinical mental health program this fall. We're glad to have you, and we're, again, glad to have McAfee co-sponsoring this event. See Emily Coons, social worker that I have the pleasure of working with at U of L, University of Louisville Hospital, in the spinal cord medicine program there. And some of her colleagues, I think, are also joining us. Greg is here, Director of Spiritual Care and Mission at St. Mary's Medical Center in Huntington, West Virginia, working with hospital staff who are struggling big time with fatigue. Maria is Director of Pastoral Care. There's Sandra, welcome, oncology social worker. And I think that's the group. Are we ready?
This is Rosa Perez Williams from Sharp Hospital in Coronado, California.
Okay. If you all can hear me, Rick Underwood, just make a note there in your chat box. Yes, I can hear you, or something like that. And there's Claire. She's been with us before. We're glad to have you. Good. Well, good. And there's Laura Broadwater. Thank you. Know some of these folks here from an old unit you used to work with. We're glad to have you. Let me go ahead and give some initial explanation about the Compassion Educator Certificate. Dr. Figley is associated with the, I have to look it up each time, Green Cross Academy of Traumatology, and they do certification, several different ones, and this is one that she's involved in. And for an additional couple of webinars that she will offer, along with our participation in those and doing a final self-evaluation and an extra fee of, it looks like $80. You could also get that certificate, and hopefully she'll say some more about that. And if we need some clarification on that, you can email me at rick@oats.org or ck@oats.org. Gene Knetz is here. He's one of a retired MFT, LPCC. We're glad to have you. Ms. Barnett's here from Jasper, Alabama, formerly Houston, Texas. I've known her for several years. She took part in our program for laypersons, training in spiritual care, and has continued to do good work through the years. Okay, looks like
I made it. Thank you all. I don't know why my audio did not connect. We did an earlier run through and everything worked fine. And of course, when it comes time, everything goes wrong. So, you know, just had to keep plugging at it till we got where we wanted to go. I so appreciate, Rick, that you got things going and kept things moving until I could join the group. So I'm going to have to catch up in the comments and get caught up with who's in class. Let me go ahead and bring up my presentation. Oh, and here we are. Welcome to Welcome to Compassion Fatigue Educator. This is a certification course, and what I'm going to do is present pieces of it to you this evening to meet the goals that Rick and I had talked about for Oates Institute virtual symposium participants. Now, what I want to do is find a Tommy, which button do I push so that I also see the participants while I'm talking?
So for the camera view, you should have view everyone, view who's talking, or active cameras.
Okay.
And so everyone will show everyone, or active cameras will show the folks who have their cameras turned on.
Okay, I'm gonna let that go for now because I don't find it. We've already lost a lot of time. So obviously my name is Kathleen Regan Figley. I assume Rick gave me an introduction. So what I'm gonna do this evening, we'll talk about the course goal, the course objectives. The objectives are going to be different for virtual symposium participants and certification participants. So I'll talk about that in just a minute. We're going to talk about what compassion fatigue is, and I'm going to share a model. It's a model that Charles Figley began working on in 1995 when he published his book on compassion fatigue, and it has evolved over time, and he and I have been collaborating on that model. So you'll see where we ended up so far. And then we're going to review the materials that you were sent for as a pre-course assignment. And then we'll look at the self-care plan template. So I was very excited when I read about Wayne Oates and the work that he pioneered and the work that he did in the area of integrating spirituality, religion, and psychology. In 1979, I was taking a course, Supernatural in Literature. It was one of 3 different classes that I took in Lit. And I was also in counseling at the time. It was a post-divorce situation. And my reading assignments and my counseling combined to lead me to develop a philosophy. And I opened my paper with a passage from the prophet about self-knowledge. And the last lines of that section are, "For the soul walks upon all paths. The soul walks not upon a line, neither does it grow like a reed. The soul unfolds itself like a lotus of countless petals." And that last line became kind of the theme or the mantra of my life. And what you're seeing in this photograph comes from my website at kathfigley.com. And on the top, you see, it says, "The soul unfolds itself like a lotus of countless petals." And what has happened for me over the course of my career, I got my undergraduate, my various degrees, and the work that I've done, etc. That soul kept unfolding, and in 2009 I developed a course called Making Meaning of Trauma, an integration of psychosocial and spiritual approaches, and I taught that several times at Tulane, but first class was in 2009. So I've been looking at this integration actually since I was in undergraduate school, and I find it to be very exciting, and I'm really happy to be sharing this evening with people who are likewise interested in integrating psychological and spiritual approaches. Here we go. So the course goal, you should have a participant workbook. Those were emailed out along with the self-assessments. And here, our course goal, which you saw on page 1, is to provide you with the knowledge and skills necessary to reduce the secondary impact of working with traumatized populations. Well, these days, who are the traumatized populations? The people who you may have worked with in the past now have a whole new layer of things that they're dealing with, as are we, the practitioners, right? Because we're all dealing with the challenges of 2020. The objectives, so after this session and the session on the 23rd, you'll be able to recognize the elements of the model. You'll be able to analyze your current level of self-care using the SCORE pattern analysis worksheet. You'll be able to develop goals based on the SCORE pattern analysis, and you'll be able to provide mutual support to a colleague who also seeks to build resilience through this process. With the Compassion Fatigue Educator Certification, if you're interested in that, you'll have some additional requirements that would come over 1 or 2 sessions outside of the virtual symposium. The purpose of developing this certification to begin with, it's a certification that I was involved in developing, is to make sure that when we're putting people in harm's way, if you will, exposing them to traumatic material, we have to have a way to balance that exposure out and make sure that that person stays whole and thrives in their profession. And people who have, I saw somebody was in profession for 25 years, people who have been practicing for a long time have learned how to manage their compassion reactions. So they're the folks we're going to learn from. The people who are new or fresh and excited and interested in learning, or excuse me, I should say interested in treating people, Well, they're the newbies who can learn from the folks who've been around or who may have already begun their own ways of tending to their compassion stress, because right now, compassion fatigue is a household term. It's been around since 1995, as I mentioned, and it's that whole concept has integrated through helping professions and any other environment where folks are exposed to traumatic material. So in this class, we are peers in this learning environment. I abide by Green Cross Academy of Traumatology standards of practice and standards of self-care. We'll talk about those in the other course, but you do have that in your workbook. Those of you who have registered for or who register for the CFE certification will work with someone in class on their self-care plan and use the template provided. Obviously, those of us who are practitioners know confidentiality is of the utmost. We never have permission to share anyone else's material, only our own. That goes for this classroom environment because it can touch on sensitive areas. And flip side is don't share more than you feel comfortable sharing in the classroom environment. Maintain those boundaries, those healthy boundaries, but take things far enough that if you can benefit from sharing, that you go ahead and share enough so that you can benefit from the material. Here are the certification requirements, and this is something that I will work through with you because Green Cross has given special rates for Oates Institute participants. This is different than what you will see on their website. So to join as a member is $25. You've already signed up for the 2 virtual classes. There'll be, as I mentioned, additional meetings that we will have. And then there'll be a final self-care plan that has to be submitted, reviewed, and feedback integrated before it's approved. Once the self-care plan is approved, then I'll issue a certificate of completion, and then you have the time to go ahead and submit your work to Green Cross no later than, not your work, your certificate, to Green Cross. The deadline to me would be March 16, and then the deadline to Green Cross would be no later than March 23. They allow a 30-day window or 1-month window for accepting people at a reduced rate because they've gone through a compassion fatigue educator course. So anybody have any questions about that right now?
Yeah.
Go ahead. Okay, no questions at this time. All right, let's go back here. So if you're interested in becoming certified, and you may not decide this until after the second meeting that we have, you can email me and I'll send you a link for the payment. I'll send you Adobe Connect link for additional course materials, and I'll send a survey to determine the best time for the group to meet. So to wrap up the introduction session and to set the tone for the next segment, I want to read to you a poem that I wrote some years back. I was attending a conference, I was actually doing a compassion fatigue educator workshop. It was in Indiana, I believe, and the participants were working on self-care assessments, and I wrote this poem. The joy of your work is tarnished by their stories. Their pain is your pain. Flashes, images, still with you when you're sleeping, do not serve you well. You know what to do to rejuvenate at depth. Take care of yourself. So the question for us as practitioners is, what does it mean to rejuvenate at depth? And that's what we'll explore as we work our way through this session. So next, I'm going to pull up the slides for the presentation on compassion fatigue. Not that one, it is this one. So, whoops. Just go ahead and call it out because I can't see you. How many of you are familiar with the concept of compassion fatigue? Just say yes or I am or whatever.
Yes.
I am.
Yes, I am.
Yes.
Yes, I am.
Okay, let me ask it the other way. Anybody never heard of compassion fatigue before? So this group is familiar with compassion fatigue. So what I want to do is show you a model of compassion, stress, and fatigue that Charles and I developed together in 2017. It's in your participant guide on page 6. And as we go into that, I just want to touch on the concepts of shared trauma and shared resilience. As a nation, we have been through a lot in the year 2020. But when we think about what we're going through, what we also think about is what we have done in the past to cope. So our country has found resilience in the aftermath of the Oklahoma City bombing, in the aftermath of September 11, and we will find it again as a country post-pandemic. So what we're doing as a country is we're sharing the experience, but we're also learning from one another how we cope. This happens in my neighborhood, this happens in our city and county, our state, and across the country. So it's multi-layered, which makes it very, very rich in terms of the types of examples we can turn to as we discuss this. So the compassion fatigue resilience model, darn. The compassion fatigue resilience model indicates what the primary risk and protective factors are when you're looking at compassion fatigue and how to be resilient from it. It's originally developed in 1995 and it's evolved over time, and it is evidence-based. So that's one of the things we always want to make sure of when we're presenting our work, is that we do have it grounded in research. So this is the model, the compassion fatigue resilience model. Have any of you seen this model before? Just shout out. No, okay.
No.
Okay, so at least one person hasn't. So, so what I want to do is talk about the elements that lead to the empathic response, that lead to secondary stress, and lead to compassion fatigue resilience. So people who have empathic ability are more prone to developing compassion fatigue.
Mm-hmm.
It makes us good therapists, practitioners, but it also makes us vulnerable. When we have empathic concern and we combine that with exposure to suffering, we're talking to the clients or whatever environment we're working in, we develop an empathic response. And that's a good thing. That's how the client knows that we are connected with them. And that's an environment where we know healing can take place. The client needs to feel understood. And when we provide that empathic response, the client knows that we are there with them. So that's a good thing. There are things, though, that can impact how much empathic response remains and whether or not that empathic response starts to turn into compassion fatigue or secondary stress. So we look at what the protective factors are. Sense of satisfaction, and you have a measure, it's in the ProQual, that actually measures compassion satisfaction. Social support is another factor. So having a supervisor is very important in a clinical environment or in a practitioner environment. That may be, a clergy environment as well. Could be a hospital environment if you're a chaplain. There's all different environments where we may practice our skills. But social support is really important, and that can help someone cope with empathic response that's residual. So that's a protective factor. another protective factor is detachment, that ability to get involved in something else that's absorbing, to move away from that which causes us to feel stressed, and instead let go of our work and move into something that brings us into a well, into another environment, whether that's a family environment, it's a hobby, it's a something else where we let go of our work and we enjoy ourselves, or we do something else that is useful or productive or satisfying in some kind of way. And then self-care. So self-care is what we're going to focus on a lot here, but self-care is also a protective factor. I recently took a workshop from a woman named Pam Bazina, who is the human resources manager at Big Bend Hospice here in Tallahassee. And what she talked about with self-care is how important it is to think about the way we talk about, is the glass half empty or is the glass half full? And what she said is self-care means you keep your glass full, and the overflow is what you give to the people you're working with. And I thought that was a really interesting way of thinking about it. So I just wanted to put that out there, that what we want to do is to keep ourselves thriving and in such a healthy state, mind, body, spirit, soul, heart, however you want to frame it, that we have something to give, that we're not operating from a deficit. And all too often, we can work ourselves to a nub in the name of whatever occupation or vocation we're involved in, when in fact what we're doing is depleting ourselves, and that in turn can harm the people we're working with. So we have the risk factor of exposure to suffering, you see here with the red bolt. And when you combine the exposure to suffering, the empathic response, and the protective factors, you come to what will be a level of secondary stress. So we want to prevent secondary traumatic stress. That's why we want to focus on these protective factors. And there are other factors that may be outside of the clinical environment, may be inside the clinical environment. I'm calling it clinical. You know, please insert whatever term works for your work environment. Traumatic memories, our own traumatic memories can be triggers. And those triggers come from working with people who have been traumatized themselves. So it's important for us to be aware of what our personal traumatic memories are, how that might impact our work, and how that may contribute to the development of secondary traumatic stress. Another risk factor, these are our risk factors. Another risk factor is prolonged exposure to suffering. So people who work heavy caseloads expose themselves to a lot of suffering, and that can increase the risk of secondary trauma or secondary stress. The other, heavy client workloads, long work hours, no days off, or extreme suffering. Those are all risk factors that can contribute to secondary traumatic stress. And then we have our personal lives to deal with. Now that can be a risk factor or a protective factor, depending on what is going on in our lives. So, and as I get into the next section, I'll show how these can be measured and how we can work towards compassion fatigue resilience. That's really, really where we're headed, really where we want to be. Any questions about this? Okay. So the next thing that I want to talk about is building resilience through self-assessment. And let me pull up those slides. Hello, everybody. It's nice to see you. Oh, goodness. So in your participant guide on page 7, you'll see the psychosocial spiritual integration model. And the other thing that we'll talk about is the pre-course assignment for the self-assessments. Let me just ask, please just call out, have you been able to complete the self-assessments prior to this class? If you haven't, it's fine. It's not a worry at all. I'm just wondering.
No.
Okay, that's very common. A lot of times you don't have the time beforehand, but there's plenty of time between now and the next class. And we can talk about the self-assessments. You can ask questions about them if you've looked at them, but we'll work through all of that.
So we also have a handful of yeses in the chat room. So we got a mixture.
Oh, a mixture. Okay. Well, for those of you who have completed the self-assessments, I'm sure you will have questions because people always do, and that'll help the folks who haven't been able to get to it yet. So we will begin developing our support of one another in this class by sharing that type of information. So this model that I'm about to show you, I first developed it for Tulane undergraduate students. And what I wanted to do in my course, Making Meaning of Trauma and Integration of Psychosocial and Spiritual Approaches, I wanted them to actually work through the self-assessments and do a case study. So my first version was way thinner than what it is than you're going to see here. But nonetheless, it gave them the information so that they could do their own case studies and learn how to use these models. So here you see the model, and I'm going to go through each of these sections. But on the left-hand side, there's A, B, C, and D. And typically when there's an event, well, we know there's acute trauma and there's cumulative trauma. So acute trauma, it happens once, it doesn't happen again. And that is more along the lines of the way this model was built. But what we have is cumulative trauma. We have multiple traumas over time in 2020, plus, now I lost my train of thought. Just let me go with that. So anyway, I know where I was going. So usually we can say, hey, the event is over, and we can look at demographics, state and trait resilience, and the history, etc. And that's our subject at the moment. And then what we do is we want to go through the post-trauma level of functioning. So that's represented in blocks E, F, G, and H. And what you see there is the 5 trauma victim questions. This comes out of Charles' work. And I found that these were very helpful in helping people frame what their stressors and traumas were, what their reactions and symptoms were, and where they could go as they work through to their post-trauma mindset, which is, what will I do if something like this happens again? So I'm going to go through each of these now. So to assess pre-event level of functioning, we want to get demographics, name, age, gender, marital status, income, education, occupation, vocation. For the purpose of the self-care plans, age, you don't have to answer all of these. If something feels private to you, that's not necessary to put it in there. But I'm going to be forthcoming in this class because compassion fatigue educator shares information as well as supports another person when that person shares their information. So I'm Kathy, I'm retirement age, female obviously, married. My income is adequate to meet my needs and then some. My education is a Doctor of Ministry degree. And my occupation/vocation is in the area of compassion stress management, psychological trauma, and disaster. I have limited how much work I'm doing right now, but I can tell you that the work that I have done in the area of psychological trauma over the years and disaster work has just been Very, very rewarding. Also very, very stressful. So now we're looking at getting into the self-assessments. And if you would, turn to your pre-course assignment, and you'll see on page 5, the ego resiliency scale. So these are traits that help us when we have strong ego resilience, when we have self-compassion, good, strong self-compassion, and we understand our spiritual intelligence. These are things that can help us thrive. You can see here on ego resilience, I've created a scale that shows, based on score, the various levels of resiliency trait. And that is what we will look at when we look at our score pattern analysis. I'll get to that in a bit of time. How many of you, oh, and then when I was researching about Wayne Oates, I saw that he was the person who coined the term workaholic, which is a term I hate to admit I use very frequently in my professional career. So I also added the work addiction risk test for those of you who might be interested in doing that. And I put that as a trait rather than a state. So, you know, there may be debate about that, but that's where I included that. So we're looking at trait resilience. How many of you are familiar with D.B. King's, oh, I'm sorry, I skipped self-compassion. How many of you are familiar with Kristin Neff's work on self-compassion? Anybody? There is a whole new world to explore there. I've got her website listed in the form here, or in the instrument, I should say. And I believe there's a self-scoring version online. So if you go to her website, you may be able to do the self-scoring version. But what she does is she talks about self-kindness, common humanity, and mindfulness, 3 factors that Neff identified as being part of self-compassion. And these are pretty straightforward. If you look on page 9, self-kindness, being warm and understanding towards ourselves when we suffer, fail, or feel inadequate, rather than ignoring our pain or flagellating ourselves with self-criticism. So, you know, those of us who are hard on ourselves, we look at self-kindness and go, yep, I got some work to do there. Then common humanity, recognizing that suffering and personal inadequacy is part of the shared human experience, something that we all go through rather than being something that happens to me alone. I remember when I was first in counseling, someone said to me, oh, what you're going through is very common. And I felt a bit indignant because I thought that my pain was unique, and I just, at that young age at the time, I just didn't understand that other people could have go through the same kinds of things that I was. I didn't know people who were. So I learned about common humanity. I grew in that area. And then the other factor is mindfulness, a non-judgmental, receptive mind state in which one observes thoughts and feelings as they are without trying to suppress or deny them. Mindfulness has really grown in focus as people are learning how to manage their stress in general. But this is a nice definition, a non-judgmental, receptive mind state. You just notice it and let it go. So that is self-compassion. There is, again, a lot of richness at Kristin Neff's site, and I hope you will take a look at it. At the second session, when we review these people's scores. We go deeper into all of these instruments. I can go further, but right now I just want to give you an idea of what these measures are and why they're included. The next that I wanted to mention is, oh, I'm sorry, I forgot the spiritual intelligence inventory. Oh goodness, D.B. King's work. D.B. King, in his doctoral thesis, developed this inventory, and he's been well, you can see it's developed in 2008. It's page 10 in your self-assessments. What he did was define different types of spiritual intelligence. And I was absolutely fascinated by that, because the people's spiritual intelligence preferences, if they attend to them, can actually help them, well, grow spiritually. I kind of walked myself into a little corner there. But he identifies 4 types of spiritual intelligence: critical existential thinking, personal meaning production, transcendental awareness, and conscious state expansion. So just like people have a preference for or are introverts versus extroverts, people may thrive best by finding meaning and purpose in the work they do, or they may need to go bigger in their thinking and into the contemplation of meaning and purpose and metaphysical issues. So the information is there. I'd like you to read that, and we will talk about that again when we get together in a couple of weeks. The post-traumatic growth inventory is a fairly recent inventory. Are any of you familiar with the post-traumatic growth inventory? So what happened after September 11 is that there was a surge in research about resilience. Why did some people develop PTSD when other people didn't? And for the people who did have PTSD, how did that impact them? And looking at the ways that people changed as a result of a traumatic experience is what we have here. This is the short form that you see in your workbook. There is a long form, but you have a lot of questions in all of these inventories, and I didn't want to go with the long form. But I put this both as part of a person's background, but also, again, as part of post-trauma mindset. Because every time a person goes through something that shakes them to their core, they're called to adapt again, building on strengths from the past and perhaps generating new ones. So that's what post-traumatic score is about. And then we look at state resilience. Holmes-Race scale has been around since 1967. It measures cumulative stress in basically in one's personal life. It doesn't measure the stress of one's work life, but it does measure the stress of one's personal life. And I looked at that instrument and thought, how many items here are related to COVID and people's experiences during the COVID pandemic? And there are items that you can see, change in residence, no, not change in work hours or conditions. If we've got people working at home, that's going to be a factor. If people have been going to classes in person, then they're going online. That's a change. Change in recreation, church activity, social activity, change in family get-togethers. Those are all items that relate to cumulative stress. So what we're looking at here really is how much energy is required to adapt. And based on the stress, the energy that's required to adapt, there are categories that indicate what a person's chance of developing illness might be as a result of that stress. We know that chronic stress can hurt the immune system. So we want people to stay strong and healthy, and if they're having a lot of things going on in their lives, find a way to balance that out.
I have a question.
Yes, please.
Hi, this is Sherry.
Hi, Sherry.
I was looking at that adjustment rating scale or readjustment, and what if somebody's had, like, I've had three, my stepfather, my stepmother, and my father have died in the last 4 months. So do I score that as the 63 times 3, or is it just the 63 no matter how many deaths there's been?
I would do it each time, and my heart goes out to you. I lost my mother and my brother within 2 weeks of each other. Yeah, my heart goes out to you. But yes, I would rate that. And here's another thing about that, and it goes to the questions to consider on page 16. Does your score seem to accurately reflect the level of stress in your life as you see it? And what does the perception of life events have to do with the effects of stress on you? So you may look at what happened and say, one score of 63 is sufficient, and you may have a rationale for that. But then you may look at it and say, these were, one was sudden, unexpected. Well, do you mind talking about it? We can just talk about it if that's okay.
That's fine.
Yeah, go ahead. So let me ask, were any of the passings sudden or unexpected?
Yes, the middle one that happened in mid-December was from COVID and was very unexpected.
Okay, so that's a 63. Can you mention another one?
The first one was my stepfather, who had been going downhill for quite a while, and I went out to give my mom a break, not knowing the real state of things, and never left because he died about 3 days later.
Okay, so that one, could we say that was expected?
We could.
Okay, so that one might not, if the middle one is a 63, then the other one may not be as high. And so you can play around with that. It's really subjective.
Okay.
So, and then evaluate, but sudden unexpected, I'd give full points. Absolutely.
Okay.
Okay.
Thank you.
You're welcome. Any other questions on that? Okay. And then the next measure, and I absolutely love this one. How vulnerable are you to stress? This is where the rubber meets the road, because what we want are scores that provide us excellent resistance to stress. And this is a very, very practical measure. When you look at this, if you score items in the never column that will increase your resilience to stress, then that's the kind of thing you want to look at for a self-care goal. And I've been doing a self-care plan for, I'm trying to think when I started, it was over 15 years. And I've been working on these, and now I only have one item left that I haven't conquered. And it's a hard one. And I'm going to seek some support for that, because it's one that has changed over the last year, and I need to get that under control. So I was very happy to say that when I calculated my score, I added up the figures and subtracted 20, that I had a score of 8. So if my social readjustment rating scale was high, but my stress vulnerability score indicated excellent resilience, then, or resistance to stress, then I'm in the right ballpark. So now we move to the other side of the diagram that I showed you earlier. And what we want to look at is the post-trauma level of functioning. So the reality is with COVID, we're not post-trauma yet. We still have it. We still have the fear of getting it. We are not vaccinated where we have herd immunity yet. But I think we've all found our ways to survive in the current environment. So what we are looking at is actually an ongoing shared trauma, not a trauma that's over. But we could say that the January 6th insurrection, that's over. We know that's over. So then we can process and work with that in a way that's different when something is still ongoing. So when we're talking about trauma, we talk about sudden and unexpected is one of the categories. And you see that here. If a disaster or a trauma is expected, then we have time to prepare to adjust. If it's sudden and it's unexpected, that's harder to deal with. When we're looking at human caused versus natural events, you know, I'm in Florida, we get hurricanes. Up northeast, they're getting snow, or maybe it's central part of the country now, I'm not sure. But when it's expected, we bring in what we need. You know, my sister who's up in New Jersey said, you know, being home during COVID doesn't feel normal, but preparing for a snowstorm does. And so when it snows up there, she feels at peace because that feels normal. That's a natural event. Human caused events, which can range anything from pilot error that crashes an airplane, through to someone giving someone else COVID. The human caused can be harder to cope with. And there can be times when people are struggling. You know, they want to place blame, and maybe it's difficult to place blame because it was not in the person's control. So that brings another layer, whether the event is human caused or a natural event, and whether or not there's, you know, some situations a human caused event can lead to a trial. And when there's a trial, then that event continues on. It's not over until the trial is over. So those are all parts of dealing with stressors and traumas. And what I did here is to include, this is from the SAMHSA phases of disaster page, is I included the phases of disaster, which usually I can speak to very cleanly when we're talking about a hurricane or a tornado or a flood or a tsunami or whatever. You know, with a disaster, there's warning and there's threat, and then there's impact. Well, with COVID, the warning and the threat were just kind of out there somewhere in the Northwest. In Oregon, I believe, is where the first signs of COVID were coming up in our country in the West Coast. So I didn't start to feel the impact of it until they started talking about the risk. And I think for me, that was like late February, early March. And that's when we started seeing impact in our country, and we're still at impact. Now, what we're also seeing during this phase is some of the heroic phase, some of the disillusionment. Yeah, there's some taking of inventory. And what do I mean by all of that? Well, the heroics that I saw, and you may have examples, and I'd love to hear your examples. The heroics I saw are initially the people who made masks, the people who talked about the safety measures and what people could do for nutrition So they were trying to find ways to help people feel safe in a situation initially we didn't even know what we were dealing with. So there is some heroic activity. There's also a lot of disillusionment, and the disillusionment has resulted from the fact that we have not felt safe. The leadership, well, let me put it this way. I worked for FEMA as a disaster worker, and I work for State of Florida Emergency Management as a disaster worker, both in the area of human services. And the most important thing you can do is get the federal programs, federal disaster programs activated that are relevant to a pandemic. And that did not happen. And as a result, for me, severe disillusionment set in, because I knew what this country was capable of doing had we had someone like Craig Fugate, the former FEMA administrator, in charge. I used to work for him. He was magnificent. And he would have done the right thing. Protect people. Protect people is the bottom line. So the disillusionment is there. Honeymoon phase is kind of when everything is pulling together, and I think we'll find that cohesion as we move into 2021. We're getting vaccinated, and we've got mask mandates. So there are things that are happening that can create that sense of safety and that can help us move forward. Let's see. So the phase is warning, threat, impact, heroic, honeymoon, disillusionment, and then reconstruction. So reconstruction after COVID is going to be very interesting, because what's going to happen with schools, what's going to happen with medical practices that are now running beautifully, but because they can't overschedule because of waiting rooms. What's going to happen with businesses, people going back to work or working from home. There are all kinds of things as we come out of this pandemic that are going to create a new beginning, and we're all anxious and ready for that. We don't have it yet. So we do the best we can to cope, and that's what you do during impact. You find the best ways to cope. Any questions or comments about that? Okay. So next we look at reactions and symptoms, and I've got a checklist. Unfortunately, the two checklists I'll mention here, I didn't make into my self-assessment pre-course workbook, but we can get those to you, and I'm going to review them here. But I love this cartoon. Stop looking at the news. You're getting all puffy. That puffy cat is me, and that talking cat is my self-care buddy, who's saying, hey, you need to, I see you're having a reaction, you need to do something different. So maybe we're not as directive when we're a buddy, but I like this cartoon. So what I called caregiver reactions, this list originated out of Charles' 1995 book, and it has been added to by course participants. And you can see there are 6 domains that we're looking at: cognitive, emotional, behavioral, spiritual, interpersonal, and physical. So here we have spiritual, interpersonal, and physical reactions and symptoms. So we started with the spiritual because we are looking for integration of the spiritual into the psychosocial, questioning the meaning of life. I've seen this happen. Actually, after the Sri Lanka tsunami, I was deployed over there. The Asian tsunami, and I was deployed to Sri Lanka, and that was one of the questions that came up about the meaning of life and being angry at God and questioning religious beliefs. So we see this happen frequently, and it happens for ourselves as well. So interpersonal, we can see people withdrawn, and that can be a kind of avoidance. decreased interest in intimacy or sex. It's getting late. I'm a morning person, folks. I'm sorry, I'm slowing down a little bit. This is my wind down time of day. Let's see, isolating from friends. And we're having to do that right now because of COVID, but that's an interpersonal stressor to be isolated from friends. Let's see, loneliness, intolerance, etc. Physical symptoms, we see those here, and impaired immune system is a consequence of chronic stress. So we really need to pay attention to taking care of ourselves, and we'll talk about how to balance out these symptoms. Cognitive. Some of the symptoms that you see here are likewise symptoms of PTSD. So you can see trauma imagery, preoccupation with trauma, diminished concentration, anxiety, guilt, survivor guilt, numbness, helplessness, depression, hypersensitivity, negative coping, elevated startle response, hypervigilance. These are all things that you might see in someone who has PTSD. And what is the reality? Compassion fatigue, secondary traumatic stress, is a form of PTSD. It's caused not by directly experiencing the trauma, but by witnessing someone else's trauma. So when we're working with folks, we are absorbing their material, and that can cause us to have symptoms as well. Impact on professional functioning. There can be a decrease in quality and quantity of work, low motivation, perfectionism, obsession about details. Morale can be low, and you can see there are a number of factors here. And this detachment is not the kind of detachment I talked about in the model earlier. This detachment is as a result of just feeling so low that there's no involvement. Interpersonal impact. One of the things that we see is people who ignore their own needs because they think that they have to attend to their clients. And that can be a problem. Like I said before, we want to keep the glass full and overflowing. We don't want to get it survival mode and just give crumbs to the people that we're working with. And then here we can see how it shows up: irritability, overwork, job changes, absenteeism, exhaustion, just a number of things. Can any of you relate to any of the things that you've seen here? I certainly can. Anybody care to share an example, either of themselves or someone they've worked with, when they've seen that the person has actually had reactions based on the work that they're doing? I'll go ahead and share an example, and it's a sad example, but it shows just how far-reaching compassion fatigue effects can be. There is a researcher, John Wilson, who was one of the early pioneers in the work in trauma, and he got so deep into the work that he committed, he had faulty judgment, and he committed ethical errors. And as a result, he lost his position. And the saddest part of it was that he knew the material. He knew about trauma inside out, upside down, and sideways. And yet somehow the compassion stress of the work got to him, and it affected his work. It affected his professional functioning, and it affected his career. Now, what was interesting, there are some who said, this man has suffered, we need to support him. And there were some who said, this man is professional, he should have known better, and losing his career is appropriate. So that's where we have to look at our own compassion and say, which side of that do I want to be on? And if we're healers, then what we want to do is look at helping him find his way back. So I just put that out there. You know, it's easy to judge other people, but it's far more important to show compassion when we understand. And then, you know, we need the person to follow through. And that's where the story ends for me, because I was not directly involved in this. I'm aware of it only.
I saw something today, if I could share it real quick.
Yeah, sure, please.
Thank you. I was talking with a care receiver who's just feeling like, I don't know why I'm so tired, and I just have this malaise. And I saw a picture. It was a little stick figure that was burdened down by this enormous rock that's probably, I don't know, 50 or 100 times the size of the person.
Mhm.
And the person saying, I can't work out why I'm so tired lately. And on the rock, it says, the cold of winter, plus a lack of sunlight, plus lockdown, plus the uncertain future, plus the whole of last year's generally, plus the unrelenting news cycle, plus that email you've been putting off, plus the lack of human contact, plus some other shit you can't quite put your finger on.
Exactly.
And it was just so helpful to say, yeah, exactly.
Exactly. That is exactly it. And that's the things that you described. Not all of those will show up in the Holmes Ray, because it wasn't designed for a pandemic. It's designed for cumulative stress. But you put your finger on it. And when all of those things are going on, then the question is, how do we maintain our sense of strength, our sense of thriving, our capacity to have joy in life? I mean, that's really important. And I know a lot of people are suffering under COVID restrictions. And I feel quite fortunate that I really narrowed my life down. I have chronic fatigue, so I already narrowed my life based on what I can physically handle. So I didn't have a lot of those big changes like a lot of other people had. And that made a big difference. So I appreciate your sharing that. I would really like to see it. Do you have access to that? Are you looking for it? Okay, so I'm going to go ahead and go on. And if you find that cartoon, let me know, and we'll see if we can't share it. So next, what I want to talk about is healthy coping strategies under G, interventions and treatment. So they, again, in 6 domains. And what I did is I matched the domains on the stressors with the domains on the healthy coping. So if someone has a cognitive thing like trouble concentrating, then you can flip to here and look at healthy coping in the cognitive domain. So here we are. Excuse me a second. Sorry. So here are some ideas for things that people can do in each of these domains. And you can read them. I wrote, have a plan B under cognitive. So we have a plan A, and that's what we want to see happen, but it's important to have a backup plan. So I learned a long time ago in disaster work to always have a plan B. Fortunately tonight there was a plan B. I could call the phone number and get with Tommy on how to get back into this GoToMeeting program, which gets to by giving myself permission to ask for help. I hate asking for help. I'm one of those folks, and I struggle with that, and I have to learn how. So anyway, there are a number of strategies here. There's have a plan B. Under emotional, have a buddy with whom you can vent. And what's important about the self-care process that I'm proposing here is that there are two buddies at all times. One buddy within the work environment and one buddy in personal life. And that way there's always balanced perspectives on getting feedback, you know. So at work, that buddy may say, you know, looks like you're missing some deadlines, you know, or you having a little trouble. At home, it might be, you know, you're kind of irritable lately, you doing all right, or going back to the cartoon, you're looking a little puffy there. How about turning off the news for a while? Oh, and all of these have practice, practice, practice underneath, because the ones that we struggle with are the ones that we just need to keep trying again and again and again. So here under spiritual, a variety of ways to kind of rebalance the spiritual effect. And I'm sure that you're familiar with a lot of these. Interpersonal, maintaining healthy boundaries is very important. Using humor, you know, sometimes we get into dark humor, and in past trainings and in this training too, I'll say that dark humor is a stress reliever under specific conditions. It has to be in private, and it has to be out of earshot of any media. So if you're working, like for me, I've worked disasters, and I may have used dark humor, but I never, ever, ever did it around disaster victims, and I never, ever did it around the media, because it was a coping strategy and not something that I wanted to hurt anybody else with. So dark humor is a natural thing. People who don't use dark humor might find it offensive. And so again, you really have to know who you're around and what you're doing. And if it's not safe to use dark humor, just keep it to yourself or write it in your journal, but don't say it out loud. Let's see, under physical, you know, a lot of this is, you know, do what your doctor and your mama told you. Eat right, get exercise, get good sleep, excuse me, and breathe. Remember to breathe deeply and hydrate. So it may be after someone has worked through this, they still need additional support outside of tools and self-assessment and that kind of thing. So here are some ideas. Strategies for inducing the relaxation response. I thought I heard someone mention progressive relaxation. Breath work. You can see all of the different stress reactions that this helps with. Breath work works with all of these. Anxiety, chronic pain, depression, fatigue, headaches, migraine headaches, high blood pressure, insomnia, irritability, and muscle tension. But breath work has to be practiced regularly. Meditation is another good one. And then visualization guided imagery is similar to meditation. Meditation may be done by oneself and may consist of something very, very simple. I'm sure you all have very good meditation practices or can discuss them well. And then there's progressive relaxation, which I think someone mentioned earlier, as a way of, oh no, that was not in this context, that was something else. Progressive relaxation is a technique that you may be familiar with, of just tensing and releasing muscles. If we were in a classroom, we would actually go through all of these, and next time we meet on the 23rd, we can do visualization or guided imagery or one of the other techniques. Compassion stress management techniques. Here are some ideas. Again, when working with clients, breath work. is something that can be done. Doing breath work with the client works for both of you. Self-talk, how to keep what's going on in your head healthy and grounded, and movement. One of the things that I think has happened as a result of COVID that may be helpful, I hope it's happening out there more than just what I'm observing, is walking and talking. Getting out there and instead of sitting in a room, getting out there. So if that's a possibility to walk with a client instead of sitting in a room, that may be beneficial. And then between sessions and after work, here's a list of various types of therapies and practices. So we're going to learn of EFT later through the virtual symposium. Journaling is good, art therapy, music therapy, poetry therapy, hobbies, music, dance. You may have others, and that's what we want to see in your self-care plan. So professional care, I do not have a clinical practice. I've always been a field worker, but these are the different types of professional approaches to managing compassion fatigue or trauma, or vicarious trauma, secondary traumatic stress. Those terms are closely linked. Eye movement desensitization and processing is one of the excellent approaches for dealing with any type of traumatic material. Cognitive behavioral has more exposure to it, but that's also very good for dealing with trauma. Do any of you practice any of these therapies? Okay.
So I'm an NLP practitioner and a hypnotherapist, but I'm not actively practicing either.
Okay. Are you, this would be putting you on the spot. Did you use NLP with trauma clients?
So my field is traumatic brain injury and has been for the past 16 years. And yes, we do bring in pieces of it, not used exclusively. Of course, we take a very eclectic group approach. But
Gotcha.
yeah, we certainly do pull in the parts that work.
Excellent, excellent. So if any of you have issues with trauma, I can say that I have had to have some of my own processed, and I've been a client under EMDR and I've been a client under CBT, and they've both been very, very helpful. So I personally endorse them. So next is building resilience through a comprehensive self-care plan. I need to take a minute because my throat is tickly and I need a glass of water, so just bear with me. Okay. So how are we doing on time here? All right, I'm going to wrap this up shortly, and then we'll still have a few minutes for additional questions or conversation if you would like to do that. So all of this goes around to the self-care plan template. Now, for the people who want to become certified, this will be a requirement. And for people who are just going to take the symposium and not pursue certification, you can see how this is structured, and you can use this if you want to for yourself or working with others. And the idea of all of this is so that not only do you know how to do your own self-care plan, but as I said in the objectives, also that you can help someone else develop their own using these tools. And you can modify based on your knowledge of the person. And we'll go into all of that next week or 2 weeks. Okay. So just like we talked about in the model, part 1 is the demographics. Part 2 is to assess, you should say pre-level, assess post-trauma level of functioning, stressors and traumas. And this is where we look at what happened and why. In I have a problem with theodicy. The question is, how do we explain God as being all-knowing, all-loving, however it is we describe God, but yet still allow evil and bad to exist? So here is where we start with the why question, and this can be explored at a spiritual level as well as at a psychosocial level. So then, to discuss the behavior at the time, reactions and symptoms for those to be identified, to look at the interventions and treatment. What are the coping behaviors? What are the healthy coping behaviors? The reactions and symptoms, that goes to your caregiver list. And then your healthy coping strategies are here. And then, what will I do if something happens like this again? The score pattern analysis will need to be completed, and that's attached. And then the goals will be developed on the self-care worksheet with an identification of obstacles and disincentives, strategies to overcome them, the identification of the 2 buddies, and the review of each other's plans with feedback, support, and accountability. So here's an example. This is Pat, middle-aged single parent, social worker, divorced 6 months ago. And Pat has good ego resiliency, low on self-compassion, high on common humanity, moderate in mindfulness, and moderate overall. So what we're looking at so far is right here, self-kindness is a problem. And this is where this Pat may need to do some work. On spiritual intelligence, personal meaning production is where Pat felt the most comfortable. Under post-traumatic growth inventory, there's some growth. On the social readjustment rating scale, there's a 51% chance of developing a severe illness in the future. That means that there is a high impact on that person's health. And serious vulnerability. So Pat's in trouble here because there's a lot of cumulative stress, but there are vulnerabilities in terms of how Pat is taking care of him or herself. Under, oh gosh, how did I miss the professional quality of life? Oh my gosh, somehow I missed two measures that I wanted to talk about, but I can talk about them here. State resilience, professional quality of life is on page 19 in your participant guide. And here it shows that Pat has high compassion satisfaction, low burnout, but high compassion fatigue. 2 weeks from now, we'll talk about how different configurations in here relate to additional actions. And then, so Pat needs to do some work here. And then here, the way the compassion fatigue plays out is through intrusion and some avoidance, but not a lot of arousal, which is kind of interesting. So Pat may need to, well, let's go to the next slide. So it's time for Pat to set some goals. So if I were working with Pat, I would ask Pat to look at the stress vulnerability measure and look at which items were in the never column and see which of those Pat would like to address first. Let's say sleep is bad. Then Pat would need to do something about how much sleep Pat's getting. Maybe change bedtime and wake up time. Maybe do something more relaxing before bedtime. I mean, there are a lot of things that can contribute to why people don't sleep well. So that would be something that Pat could explore. When it comes to the high compassion fatigue, what this is suggesting is that Pat really loves what she's doing, It's a high level of satisfaction, and the demands of the work environment are not causing burnout. It's the pain of the work that's causing the problem. So Pat needs to work on some of those strategies to let go of client material. And that may be work through in a professional environment with a therapist, or that may be something that Pat can do on his or her own. So what I've done here is I've identified SMART goals, and these would need to be fleshed out in a wording that makes the goal specific, measurable, attainable, realistic, and time-based. So one of the goals might be the overall goal is to get better sleep. The specific SMART goal would be I will go to bed at 10 p.m. at night, and I will get up at 6 a.m. in the morning and set my alarm. That kind of a thing. And it could be measured, it could be charted. That's what we want. And that would be a growth goal. Now, Pat may be doing something really well, and we don't want to overload her because because there's a lot going on. So it might be that there's something that Pat is doing, like maybe exercising every day. So that would be, go to the gym 30 minutes, 3 times a week, attend class, and that's a maintenance goal. So there's a growth goal and a maintenance goal, and that may set Pat up for perhaps having another growth goal. What we need to look at are there obstacles or disincentives or resistance to achieving the goals? Well, maybe the reason why Pat isn't getting good sleep is because there's a baby in the house. So that has to be addressed. And if that's addressed, what would be done? Well, in some households, the partners shift nights who takes care of the baby so that at least there's some good sleep. So those are the kinds of things that would have to be worked out. And that's what I'm talking about here when I say what strategies might be used to overcome the obstacles and resistances. Then here is the identification of the buddies. And it's important that both personal and professional, I mentioned this before, and then set up a regular meeting time to get together. And, it might be once a month. That might be sufficient. For somebody who wants more support, it might be once every 2 weeks. Everybody has to determine what works best for them. And then the other thing is this is a process that can be going on for years, just like I've been doing for over 15 years. Every time I take a class, I take all of the self-assessments, I look at my score pattern, I look at my goals, I look at what I need to update, what I want to continue to maintain, where I need to grow. I'm still a lotus, my petals are still unfolding, I'm still growing. So those are the types of things that we would do here. And so it's important to identify buddies who are as committed, because they can take the same self-assessments, they should, and then you support one another in that process. So that gets me, I had one more thing, let me just see. if I've got the other thing here. Open reason. Okay, so that brings me to the end of what I wanted to cover in terms of the material this evening. We've got about 20 minutes where we can have open discussion and let me get out of that and out of that. Good. Oh, now I can see you all. Hi. So let's see. So oh, the screens are popping up. Hello, everybody. So at this point, you can unmute yourselves and let's just have an open discussion of the material that we've covered and where you want to go from here.
And really quickly, if you want to turn off your screen sharing, the button that says screen, the cameras should get a lot larger for you and everyone, really.
Uh-oh. Oh, it worked. Oh, there we are. Okay. Is that better now? So at this point, questions, comments, thoughts? Let me start with anybody interested in pursuing certification. Okay, good, good. So email me, katfigley@gmail.com, and I'll go ahead and get you the rest of the materials. The deadline for getting the self-care plan to me will be March 16th. So we'll discuss that again February 23rd. And like I said before, the other thing that I will do is send you a link and some additional materials, and we'll work it from there. Okay. Okay. Other ideas, thoughts, comments, questions? Yeah, Julie.
Hello. My work is in senior living, and I have about 70 people that we've gone through the trauma together. Over the past month, we've had 30 of our residents have COVID and 17 died. We're trying to process as a group. You know, we as professionals, we have to, I'd like to manage your compassionate reaction. How do you continue, you know, caring for others? It's kind of a group. It's a group trauma the past 5 weeks, really.
So
we go.
So you were breaking up a lot. I'm not sure if I caught everything that you said, but what I did pick up is you have 70 or 80 residents in the facility where you work, and you've lost 17 to COVID. Is that correct?
Yes.
Okay, and so now the staff, the medical staff, the personnel there are looking to cope with grief and trauma, not just trauma. What you've got is traumatic grief, and that's got a whole other layer to it, right? I'm not a grief expert. I've experienced grief personally. I can refer to resources, but you really need someone to help process the grief as well as the trauma. So that would be my recommendation. Now, in terms of once the grief is addressed, then that may be a good time to go ahead and look at a compassionate risk management plan for your folks in general. And I'd really like to see every institution have some type of plan in place for their personnel. Does your facility have anything like that at all? Any EAP or anybody who can come in?
Sorry, I had to unmute. We are actually looking for someone like that. We do have a chaplain that comes in through hospitals. Not really. I guess my role is to be the leader and to help with trauma.
Okay.
And still have families that are involved. It's not just the people that have passed. There's multiple layers of families, and I was just looking for some ways to cope with.
What I would like to do, Julie, to get with you after class at some point. You can send me an email, or we can figure out how we're going to connect up. But what I'd like to do is look at the resources I have for processing this type of an experience, and I can make you some referrals. I mean, it's important. It's really important that when people come in, they understand that grief and trauma are two different things. When we worked September 11, we did not begin to address the trauma until we first addressed the grief. We worked with Service Employees International Union 32 BJ, and they were right on the north perimeter of Ground Zero. They suffered a lot of losses. So there were rituals created to address the grief, to help process the grief. And you really need someone who can come in and do that. And then that process will facilitate the rest. And I'll look both at Green Cross and at ISTSS, International Traumatic Stress Study, for people who might be good referrals. Okay, that's a good question, and that's where a lot of people are right now, is processing grief and trauma. So what I'm doing is I'm talking about compassion stress management and how to keep the work from impacting you, and how to integrate healthy coping into your work life and your personal life. When you get into situations like yours, you need more information. I'm sorry for your experience, but your question was really important. So thank you for asking. Others?
Are there other resources that you could recommend for helping us while we're developing our self-care plan?
I'll tell you what you mean by other resources.
Just as a student, I am perpetually reading. What resources might you, as you personally were developing your self-care plan, what were your best resources?
You know what I did? So the resources that are in the workbook, what I looked for was something that was relevant. It measured a factor in the compassion fatigue model, and it was free. Because a lot of assessments are behind paywalls. So there may be other instruments that are better than the ones that I've got, but the ones that I've got are ones that I can say, you can use it. I decided where I got it, when I got it, and so it's clean. But we don't want to get into copyright issues, or having to pay for things. So that was my initial incentive. So what are you looking for? More resources, as in assessments, as in reading?
Maybe more. So sometimes when I'm looking to implement something new in my life, it's always better to understand maybe what other people are doing to help implement. For instance, I just wrote a rule of life for my seminary training. And part of what I did as I was starting to write my rule of life is I went and I read, what are other people doing to help combat XYZ?
Gotcha.
To get better ideas of things that might be beneficial and relevant in my own life as I'm developing that plan of action.
Mm-hmm.
Because sometimes as we have needs, we might clearly be able to take an assessment and see, oh, I have XYZ need. And then it's finding the solution to combat XYZ need that's oftentimes the problem. Right,
exactly. So there are a lot of books out there on compassion fatigue right now. My library is right over there. I could pick up a half a dozen right now and show you, but my headphones will make my head sick. One of my favorite resources is this book right here. Woo! It comes out backwards. It's the Encyclopedia of Trauma. This came out in 2012. And this is an excellent resource. And if you want to build your biceps, you can lift it a few times and it'll get you some muscles too. But that to me is an excellent resource. And it's not just because my husband was the editor and I was the managing editor. It's filled with the wisdom of international scholars in the area of psychological trauma. I'm trying to narrow down. I would love to send you some of my reading resources. Send me an email and say recommended reading. I'll send you a list, and if other people want it, we can share it next time also.
Thank you.
Sure. Other questions? Okay, well, it's 10 till 9 by my clock, and I would have been getting ready for bed about 20 minutes ago. So thank you for putting up with my somewhat end of day type energy, but I'm really happy to be here. I'm glad I get to see you. I'll look forward to seeing you in a couple of weeks. I'm available by email to ask questions. Next time we will go deeper. We will actually review the self-care plans. We'll see what other additional resources we come up with. Julie, I'll look up for resources for you, and we'll pick it up in a couple of weeks. Rick, any concluding comments?
Thank you for the excellent presentation, and you've given us a whole lot to work with here. I appreciate it. I know everybody else does. On Tuesday or Thursday at 3 o'clock, we'll have a presentation by, I believe, Ty Mendenhall, who you know, I think. He spoke very highly of you. He's going to talk about some very practical things, toolkit for compassion fatigue that they've developed. So we will see you all back on Thursday at 3 o'clock. All of the sessions are being recorded, and Tommy will be sending those out for you to go back and review because we covered a lot of material here tonight in a short time. We'll also be reaching out with email to each other to form an email group and having some conversation about tonight's presentation. So I'll be doing that tomorrow, and you respond at your own convenience and your own time. Thank you so much for staying up past your bedtime. And
my pleasure. Y'all are a nice group.
I'm getting there as well. And thank all of you for being there, being here tonight. And we'll see you on Thursday at 3 o'clock Eastern Standard Time. Good night.
Good night.
Thank you.